Welcome back to Veterans Health Watch, the newly modified home edition. During the COVID-19 pandemic, we're all still hearing and reading reports about this topic. But one of the most important things we all need to know is how to reduce the risk of infection. U.S. News and World Report relied on one of our epidemiologists to break this down for the whole country, and she's joining us today. Welcome, Dr. Rugman.
Thank you for having me.
I noticed in your article that you were able to break down the risk of infection into 3 C's. Tell us about this.
Oh, so the 3 C's are a way that you can think about how you can prevent yourself from becoming exposed to someone else who has COVID-19. So the 3 C's are: first, C for crowd; second, closed spaces; and the third, close conversations. So those are the areas that you want to avoid. And in particular, you want to avoid the intersection of those 3 areas. So if you think about it, if you are indoors with a crowd and you are eating, you are actually at one of the highest risks of becoming exposed to somebody with COVID-19, mainly because you can't protect yourself with a face mask while you're eating.
Okay, so that is a loaded response. I have so many questions now. When you talk about the crowd, the first C, the crowd, what would be considered a crowd? 5, 8?
So I think about crowds as being greater than 10 people. Now it does vary. So a crowd can be much smaller when you're inside. So in a conference room, I think of a crowd as being 4 people. But if I'm outdoors on a deck, I might think of a crowd as being 8 or 9 or 10 people.
Okay, and then you also mentioned a restaurant, a higher risk because you can't wear a mask. And in the article, you mentioned that you're still doing takeout. So what do you think about the risk of eating, dining in, and considering those 3 C's?
Yeah, so I think that you can eat out safely, but there's certain things that you need to do. So first you need to think about, who are you eating with? Remember, I'm going to come back to this idea. You can't protect yourself with a face mask while you're eating. So that's why eating and drinking is a big deal. So you got to ask yourself, who are you eating with? So when is it okay to eat out? Well, I think you have to think about a number of things. The first is, who are you eating with? If you are eating with people in your household, that is safer than if you are eating with people outside of your household. Because whenever you come into close contact with people that aren't inside your household, all of a sudden you're exposing yourself to a group of people that you don't normally come in contact with. The second is, where are you eating? So if you are eating inside with poor ventilation, then you're at greater risk than if you're at a table outdoors. So all of those factors come into play on whether you decide to eat out.
And when you talk about eating with your household, my household is just myself, my husband, my 2 kids, but some people could think household, or does it include the people who live outside of your house or people in your house? When are family gatherings safe? How should we conduct those?
So family gatherings are interesting. So first I'll talk a little bit about a household. So we consider my household, my husband and our son, but then we also include my adult daughter. And we've just made a decision that she is part of our household, so that when she comes over, she doesn't wear a mask. And we don't wear masks in the house, and we don't physically distance in the house. However, if somebody comes into our household, say somebody is coming in to fix our furnace or an air conditioning unit or a plumbing problem, then all of us will wear masks, including the people who are coming in to do that fixing. And that's, again, to prevent spread, and we'll stay at least 6 feet apart in the household.
So it sounds like, I'm sorry, continue.
Oh, I was going to say, we can get further into family gatherings because I think those become very complicated. I have, and a mother who's 85 years old. She has a heart condition, and I know that she's at risk of developing severe COVID-19 if she was exposed and became infected with the virus. So we have had my mother over, but we have all of our events outside. So I will sit with her. I will be across the deck, maybe 12 feet as far as I can get myself apart from her. And I will allow us to take off our masks if we have that amount of distance apart.
So when you mentioned the mask, we can't talk about this without talking about mask. When should we wear a mask? When is it safe not to wear a mask? How does it play into the 3 C's?
Okay, that's an excellent question. So the masks are a way of helping us mitigate the risk that we have when we come into close contact, one of those 3 C's. And masks are both source control and protection. So for example, if I had COVID-19 and I was wearing a mask, I would be far less likely to spread it to other people. In addition, the mask, if I'm wearing it, reduces the amount of virus that I might come in contact with when I am out and about. So I'll just go through my day and talk about when I wear the mask and when I don't wear the mask. So I mentioned in my household, we don't wear masks. I drive to work. I don't wear a mask when I'm in a car by myself. However, if I was in a car with somebody from outside of my household, for a reason or not, I would open all the windows while we're driving, and I do this with my mother. We open all the windows when we're driving and we both wear masks. It must look a little bit funny, but it makes it the safest way that the two of us can share an airspace that is very close inside a car. Then when I get to work, I go into the hospital. And I could go into my office, which isn't in the hospital, but either way, as soon as I get into that building, I wear a mask. Okay? There are times when I know while I'm walking from a parking garage to the hospital or my office that I'm going to run into people. If I'm going to run into people on the sidewalk, I just put my mask on. My mask is never far away from me. In fact, I have a mask that I put with a lanyard around my neck, and I just bring it up and bring it down as I need to. So when I'm inside the hospital, at all the times I have a mask on. And if I'm going to be in a clinical area, I wear a surgical mask. If I'm going to go see somebody who has COVID, I wear an N95. So when I get into a building, I'm going to wear a mask, and I will wear that mask all the way until I go to my office. I am very fortunate. I have an office that I don't share with anybody, and I can take my mask off in my office. However, if I were in an office with somebody else, I would wear a mask the entire time I was there. And then I'm going to repeat that process as I come home. When I'm going out and about, let's say I need to walk my dog. I do not wear a mask when I'm walking the dog because I know I can stay more than 6 feet away. I'm never 100% sure though that I won't run into somebody that I want to talk to, so a mask is always with me. And I think that's what we all need to understand is when is it okay not to have a mask on and when is it really important to have a mask on? And knowing those rules will help us be able to sustain our mask use over the next few months.
Yeah. And like you said, nowadays, it's just important to always have the mask with you. At least you're ready and you're prepared if you ever are in close contact.
Absolutely.
And it sounds like you're telling us to assess the risk and how important the activity is that we want to participate in.
That's very correct. So with every activity that we do, we need to ask ourselves, how risky is that activity? And how can we mitigate or how can we change or reduce those risks? The next thing you ask yourself is if there is another way that you can do that activity. And then finally think about how much that activity is worthwhile for you.
And we're entering the cold months, and we were doing the gatherings outdoors on the deck and sports outside, but we're entering the cold months now. What are some of your thoughts or suggestions on considering those 3 C's and how we want to gather with family and friends in the cold months?
So I think for gathering with family and friends, we have to decide exactly which people we're going to come into close contact with and try and hold ourselves to that. So decide which family and friends are going to be the family and friends that you have yourself come into contact with regularly. I would try to extend the amount of time that you can spend outdoors. We recently purchased a fire pit so that we could extend our time out on the patio. I think that we're fortunate that it doesn't get really cold until fairly late in the fall, and so we can allow that time. You should think about where in your house you can have the best possible ventilation. Bigger rooms are better than smaller rooms, and having the rooms have free-flowing air ventilation when you have groups of people there is most important. And then finally, think about when you can use masks, for example, to help reduce that risk. Whenever you're in close contact with somebody who's not a part of your household, a mask is an excellent idea.
So we're recapping the 3 C's again: the crowds, the closeness of the space, the closed space, and the close contact.
Correct.
Okay. And then with the cold months comes flu season. What we hear about the flu shots, we hear about, being doubly infected with these 2 viruses. What are your recommendations about the flu shots?
So my recommendation is to get a flu shot. It's on my calendar and I'm going to be getting it soon. Why am I getting it? I'm getting it for 2 important reasons. The first is that it will protect me from getting a severe case of flu. I do not need to get another type of respiratory virus this fall. And we want to make sure that you, veterans, do not get flu, because we want to keep you healthy and out of the hospital, because we need to save those hospital beds in case we need them later on in the year for COVID-19 patients. The second reason I'm getting a flu shot is that I know that if I don't get the flu, I can't spread it to anybody else. And even though all of the efforts that we're doing to help prevent COVID-19 will also help prevent the spread of flu, I, for one, do not want to give the flu to my household members. They don't want to get it from me. And so if I get a flu shot, I reduce the risk.
Thank you so much, Dr. Rogman. And we want to encourage our veterans to get a flu shot. They can visit our webpage to learn about our drive-through flu clinics, or they can actually visit our webpage to also learn how they can find community providers who are also offering a free flu shot to veterans. So thank you so much for joining us.
2021 started differently than years past, but the new year brings new possibilities and promise, with the most important promise being the COVID-19 vaccine. So while first responders and those at risk go to the front of the line, you can help protect the veterans in your life by staying home, wearing a mask, and rolling up your sleeve to get vaccinated. Keeping your distance now will make the reunions all the better, the hugs even tighter. So stay home and help keep our veterans safe.
Over the last few weeks, you and so many others have proven that you're willing to lead the fight again.
In less than 75 days, 50,000 of you joined our volunteer list for COVID-19 research.
You are from every state across our great nation and our territories as well.
Some of you are even as far away as Guam and Puerto Rico.
You joined VA's volunteer list for COVID-19 research. It's something you could do.
To help protect yourself and the ones you love.
To get life back to normal.
To see your business thrive again.
To hug your grandchildren.
And the good news is our clinical trials are beginning to pay off.
Vaccines are proving safe and effective.
For the first time since this pandemic began, there's a light on the horizon.
Our frontline heroes and our most vulnerable veterans are now getting vaccines that will help save them from this enemy.
That's thanks to you and all those who rolled up their sleeves to participate in clinical trials.
And it's thanks to everyone else on our volunteer list who showed they were willing to lead the fight again if called.
Our victory is still many months away. And as public servants,
researchers,
communicators,
and as veterans,
we are committed to this battle.
We won't stop until we've built an arsenal of knowledge against this disease.
Until we found the treatments, the prevention, the cures we need to put this pandemic to an end.
Until then, our research goes on and we'll need volunteers.
As a father,
mother,
physician scientist,
Navy veteran,
VHA physician, I want to thank you for joining the volunteer list.
Thank you.
Thank you.
Thank you.
Veterans enrolled in the VA Maryland healthcare system have probably noticed modifications in place during COVID-19. We've invited our Deputy Chief of Staff to talk about those modifications and why they've taken place. Dr. Garcia, thank you so much for joining us.
Oh, it's great to be here. It's nice to be back in this setting after a long break. So.
Yeah, we're all glad to be back. But I'm sure some of our veterans are getting used to the modifications in care because of COVID-19, as we're all getting used to modifications because of COVID-19. Why did our process have to change?
Kenya, the reason we've had to make changes is for the safety of our patients and their families and caregivers. And that's related to the fact that with the pandemic and with the significant amount of community spread that we've seen over these months and continue to see, we have to be very sensitive to running our healthcare facilities around the state so that we can bring patients in when necessary and do it in a very safe and controlled way to keep them safe. And then we've had to balance that with figuring out new ways or adding ways to connect with our patients and their families, and that's through many of the virtual modalities, what people call telehealth, and never forget the good old telephone. I think that telephone care is a big part of what we've been doing, but those are all really based on a couple things: recommendations from VA central office, which has is a great resource for helping guide us for establishing safe care. CDC and other large healthcare organizations and groups that once again have a perspective on this that help guide us. And then what we know is going on in our state and our local community.
Some of those plans include something that our patients probably notice more obviously is them not seeing their doctor face to face as frequently as they're used to, and having the virtual care, the telephone, the video. Explain to us how that works, and are they still getting the same quality of care?
Yeah, that's a great question, and that's the experience that we're all having. One way for me to frame it, I'm a primary care doc, and I would say that so much of what I've done in my career clinically with my patients is building relationships, but a lot of that is talking and listening. And clearly, I'm a big fan of the face-to-face of being with people, and most of us in healthcare, that's why we love what we do. It's the people-to-people contact. Having said that, with the value of talking and listening and being there, yes, we're really utilizing telephone visits and virtual visits as our first contact with patients. So one, that allows for that really crucial part of the relationship to continue, to review what's going on with our patients, questions about medications or symptoms. And the second part of that is having the medical center set up so that when a face-to-face visit is required, that we can do that safely. So it is a big change, you are correct, and we're all working together, and that's why I continue to really see this as a partnership between us and our patients is, yeah, we're trying to use those safer virtual modalities, the telephone, the VA Video Connect. We've been able to also use some other modalities during the pandemic, even FaceTime and other those those methods because of the demand. But that's really our first touch point. And then, as you said, that's a different feeling. But I would say that we are, and our clinical staff continue to improve their ability, and our patients are giving us the feedback that virtual contact, that virtual touch, can actually be quite meaningful and focused and very helpful, and many times much more convenient for our veterans.
And let's help our veterans understand that the healthcare system is large. We cover most of the state. We have several facilities, and this pandemic was new for everyone. This virus was new for everyone. And with such a large organization, there's so many layers and processes in place to create this safe environment for our patients who do need to come in. Tell us a little bit more about what went into creating this safe environment and all the layers of care.
Well, so as I mentioned, I think that, so one, we have a great leadership team across the facility with different areas of expertise. And I think you will hear from, or may have heard from, some of our experts in epidemiology and infection control. And that really is what we used as our starting point for trying to understand really the day-to-day, both in the hospital, in the clinics, out in the community. How do we deliver the care that we need to deliver and want to deliver, but how do we utilize the concepts of universal masking, physical distancing, and looking at what we really need to accomplish for a patient? What are the priorities for a patient? So with that, and like you said, the multiple layers, it's everything from understanding the physical layout of all of our different buildings and our facilities, down to the level of each exam room, check-in areas, the different places we see patients, the emergency department, doing surgeries, doing testing, having people come to clinic visits, all those things. So really down to the detail of almost a choreographed structure, so that we know that when our patients come in or need care, we know exactly where they're going to go. Can we supply them with a safe environment? Can we make sure that they have the mask that's available, that they have the distance that's available to keep safe? And is our staff able to do the same? So that's been the overview. And as we do this, we do this each and every day. We've done a phased moving forward. So as we came through the initial crisis and the surge, we've really focused on moving forward, opening up clinics, once again, gradually, making sure that we don't have too many patients coming in all at once to protect them, and so that we can control the environment. And what we've seen is a gradual ramping up of our ability to bring patients in for those necessary things. And we're continuing to create that expectation that if we can do this safely, we'll continue to do it. And then knowing full well that we have to continue to improve our ability to connect with our patients via telephone and other video modalities. I mean, I'll use this moment to just interject with our audience that I think it's really important to know that we are here 24/7, 365 days a year, and we continue to be here. And we were even during the height of the first wave of the pandemic. And what I mean by that is we clearly want our patients and their family and their caregivers, if they need something, especially emergency care, we're set up in our emergency department to see all patients and see all of them safely. And we've never stopped doing that. We continue to operate our Perry Point Urgent Care Facility at that campus during those Monday through Friday business hours. And through the Mission Act, we continue to have the partnership with the community through urgent care centers that allow our veterans to get care when they need to be seen face to face. So I think that's really important, as well as the fact that even through the first surge of the pandemic, we did continue to operate a lot of our critical services, even outpatient services, so we could deliver care to our patients who were in the midst of therapies for cancer care or other therapies that we couldn't stop. And so we already had that structure to build on, and now we're ramping that up piece by piece. And I can tell you the other thing is our feedback from our veterans is really a key part of that strategy. So when I say that we look at CDC guidelines and look at our expert opinions, I want to make sure that people understand that equally so, we're listening to our veterans constantly.
But we still know that it's the safest way for our veterans to be seen first is through virtual care. And then you make that determination to if a veteran needs to come in face to face. Can you explain that process? And what should a veteran do if he or she wants to make an appointment? How would that process look for them?
Yeah, so I guess let me put it into a couple perspectives. I think I just did cover sort of the emergent, urgent, and I think that's something I want to emphasize because I really want that to be very clear. That's something that's there and established, and all our veterans should know that that hasn't changed. In terms of more day-to-day, what should our veterans expect? I think for routine appointments, we really are set up similarly, that all of our clinics, our primary care clinics, our specialty clinics, our mental health clinics, we're still scheduling appointments as we always have. But that first appointment is going to be a virtual appointment, as you said. That appointment then sets the stage for the next step. And once again, many of our patients are very, very happy. And like I said, it's very convenient, and they can have their needs met in that mode of a telephone call or a video call. But the next step is if there's a face-to-face appointment required, same thing. Our staff can schedule you in, explain where we want you to go, what the process is. For example, for certain veterans who are getting certain procedures, we have a pre-procedure testing clinic so that veterans can get their COVID test done several days before their scheduled procedure. Once again, for their safety, and they get instructions on quarantining before a procedure, and also making sure that the setting of the procedure, that we're not exposing anyone to the risk of the infection, nor do we want to deliver care that's elective care if someone actually has a COVID infection, because we need to make sure we treat that.
"2020 has brought with it many unprecedented challenges, none more pervasive than the world's battle against the coronavirus. In VA, we fight unrelentlessly this battle with COVID-19 because of who we're fighting for: America's veterans, their families, and caregivers. We fight more fiercely because of who we're fighting with: the volunteers, donors, partners, veteran service organizations, businesses large and small, nonprofits, foundations, and other government agencies worldwide who have and continue to support us in our mission. Understanding that during this global pandemic, not one individual, family, or company is left unimpacted by this virus. That is why we at the Department of Veterans Affairs take this opportunity to say thank you. On behalf of the veterans and frontline workers serving in VA, we thank you for your gifts and donations that have allowed us to serve our heroes. For everything you've done and continue to do, thank you for being a tireless and unwavering presence, a reminder of a nation who has not and will never forget the sacrifice and service of America's veterans.
This wraps up this edition of Veterans Health Watch. If you are a veteran, apply for VA health care. Just visit our website or give us a call. You deserve it.
You can find more episodes of Veterans Health Watch on our YouTube channel. Just type in VA Maryland Healthcare System in the search bar. And be sure to hit the subscribe button to get notifications of new videos. Don't worry, it's free. We'll see you on the next Veterans Health Watch.